Good afternoon. My name's Jennifer Lanny. I'm a registered nurse at Halifax and also the lung navigator at Halifax Health. Happy Great American Smokeout Day. We're very fortunate to have a local treasure, our special pulmonologist extraordinaire, Dr. Stephen White, and he's going to talk to us a little bit today about smoking, screening for lung cancer, early detection, and we will have some time at the end for questions if you have any, so please feel free to post and we'll try to catch them at the end. Welcome, Dr. White.
Thanks, Jennifer. Glad to be here.
Tell us a little bit, how long have you been in the community?
Well, actually, for those who are interested, I was born here 68 years ago. So I've been in the community a long time. But I went away, did my training, came back, and I've been here practicing now in lung diseases for 37 years. 37
years. So you've seen a little change here or there in 37
changes.
years. That's awesome. Dr. White, would you like to talk to us a little bit about some of the facts about lung cancer, the risks and things like that that we're hoping to eliminate today?
Love to do that, and what a coincidence, but maybe not. Maybe it was meant to be. Today's the Great American Smokeout. So for the last 45 years, the American Cancer Society has sponsored this special day to reach out to people who are continuing to smoke in an effort to help them to quit and to give them hope that they can. It's interesting, we've made a lot of progress. I've seen a lot of changes. You know that when this first started over 40 years ago, almost 50% of adult Americans smoked. And today that number's down to 15%. Still too high, 30 to 40 million Americans are still smoking and we need to help them quit. But it's just great to be here today and to be able to provide the community with some information on that. But particularly today we want to talk about lung cancer, because the other huge change that I've seen, and that's only been within the last decade, is we now have a very, very effective screening tool for lung cancer. Lung cancer is a devastating disease. It's the largest killer from cancer of all the cancers. It's 25% of all the cancers deaths that we see each year. That's about 150,000 of our fellow citizens who are dying as a consequence of lung cancer. And you know, as compared to other cancers that we don't always know the cause of, we know that 90% of lung cancer is totally preventable if only we could help everyone to quit smoking. So today we're going to talk a little bit about that. We're going to talk a little bit about screening so that we can get people screened early, because obviously screening early helps to save lives, because if you catch lung cancer and other cancers early, they can be cured. So I'm glad to be here and discuss this with you, Jennifer.
I wholeheartedly agree. I know I lost my own mother to lung cancer years back, and when that happened, it was devastating because at the time you found out you had lung cancer, you were given 6 to 9 months to live, get your affairs in order, and you're done. And that's exactly what happened. And so now we're starting to see all the benefits that have happened from early screening programs with breast cancers, with prostate cancers, with colon cancers. And now with lung cancer, we just kind of have to catch up a little bit with promotion of this screening. It's truly life-saving and a game changer with regards to lung cancer.
Just a huge game changer, absolutely. You know, I've been in practice, as I said, in this community for 37 years. And I don't know how long ago your mom had cancer, but I know when I first went into practice, lung cancer really was a death sentence, because at that point 90 to 95% of people who already presented at an advanced stage, because there are very few early symptoms. So by the time they were spitting up blood or having pain in their chest or couldn't breathe, they were already in stage 4. There were very few therapies, and quite frankly, people had a nihilistic attitude about lung cancer. But today that is totally changed, because about a decade ago, a very large study, the National Lung Cancer Screening Trial, was performed, and what they showed was that if we screen patients for lung cancer early, we can reduce mortality by up to 20 to 25%. And the sad thing today is that we're still only screening 3 to 5% of people. So we're here today to talk about screening, encourage you to have your screening scan, because again, although 20 to 25% might sound like, well, why aren't we saving everybody? It's because because sometimes you don't catch it as early as you'd like, but if you can catch that early lung cancer in its first stages, you can take an 18 to 20% 5-year survival to 90% survival, which is huge, just absolutely huge. So yeah, we need to get people screened, and let's talk a little bit more about that.
What do you think is kind of the stumbling block for most people? Is it that they aren't aware of programs out there?
Yeah, I mean, that's a great question, and I've wondered that myself, because the national statistics indicate only 5% of people are being screened 10 years after this huge study was published. I think it's a matter of education. I think we may, although I'm not as familiar with breast, colon, and other cancers, I think that screening really is a matter of educating the public, also getting people to take that initiative themselves. You know, don't wait for your doctor to ask you. If you're a smoker and you've been smoking for 20 or 30 years, ask your doctor about screening. There's so many things that physicians have to contend with today in so many different arenas. Go ahead and take that initiative and ask them to screen you. Let them get that scheduled, because we'd certainly like to see that 5% figure at 100%. Everyone should be screened. There really isn't anything that should prevent them. Some patients, we can talk a little bit about, the concerns that people have with regard to screening. And right up front, when you're talking about doing an x-ray, people ask me, well, doc, what about the radiation? I don't want to get the radiation. Well, this is the story that I tell them. I say, look, everything you do, when you came into the office today, you had to drive to see me, didn't you? And you took a risk at coming to drive to see me. But coming to see me was of much greater benefit, hopefully, than the possibility of getting in an accident on the road. When you do a lung screening scan with CT, you're exposed to a very, very small amount of radiation. And is there some risk? I suppose statistically there is, but is the benefit of finding your cancer early and surviving it far outweigh that risk? Absolutely. So that's the first thing I have to dispel in people's minds. Don't be afraid about getting a lung cancer screen with the radiation. The other thing is, people know that when you find cancers like this, they get a little bit worried about, what's next? What am I going to have to go through with this? And that actually is probably the most significant risk factor when we screen for lung cancer, because in screening large populations, you find things that aren't necessarily cancer. And so, you may have to undergo some additional testing, either some additional scanning, or in some cases, if you're in a high-risk category with a high-risk scan, you may have to have a biopsy. There are some risks moving down the road, but again, what you're doing in that case is you're taking those patients with a very high likelihood of cancer and doing additional testing, and if you find that cancer in that early stage, the benefit is they're cured.
Right. That's excellent. One other thing that I always worry about with patients is we're a community-based program, and we have lots of patients that are concerned about the financial implications as far as screening. And one thing that Halifax has at our fingertips is 425 Lung, and if you call that number, you get myself, a lung navigator, and we can help navigate you to programs. They can be as little as $125 to have that scan done, and it's an amazing tool to have, and it can be scary, but again, knowledge is power, and if you know that you might have something to monitor, it's certainly better to monitor it. Maybe 6 months later you see it's not changed at all. Maybe it's something you've had for years and years. The screening process itself, I think it probably takes longer to get to the screening center than the actual scan takes. So it's not a time intense, probably emotionally intense, but not a time intense process, so that's great. As far as insurance coverage, most insurance, if you meet criteria, they do cover the price of the low-dose CT scans.
They do, and this is an age group. Generally speaking, we recommend scanning 50 years of age and beyond in those who have smoked a minimum of 20. This is varying. The more data we collect after this 10-year study 10 years ago, the more we realize we have to move that age down. But probably in the 50 to 80 year age group, many of those patients on Medicare, and Medicare covers this completely. So for those patients in that 50 to 80 year old bracket, if you happen to be on Medicare at 65 or older, if you have a disability maybe a little younger, and you've smoked 30 pack years, which is 1 pack a day for 30 years or 2 packs per day for 15 years, if you're in that ballpark, then you get that at nothing. That doesn't cost you anything. And as you said, we have inexpensive screening now through the Halifax system, and many of the other major insurances are beginning to cover this as well, because when you think about it, it's a whole lot less expensive on the front end to prevent a cancer, to treat a cancer early than to treat a cancer late.
So why do you think people aren't doing it then?
Again, it's shocking when you see that statistic, 5% nationally. I think it's education. I think we have to get the message out, and that's why something like this little forum is so important, because it gets the information out to people. You talked about, what they're going to expect. This scan is so easy. You're in and out of the scanner within a minute or two. The scan itself takes about 25 seconds. People sometimes worry they're going to have to get an IV or some contrast. There's no IV, there's no contrast. It's really amazingly simple. It's like taking a photograph with your iPhone. I mean, you're in and out, and it's how reassuring is it for most people to have negative scans and to realize they don't have lung cancer, which is another benefit of screening programs that has been well documented, and that is those patients that come in and get screened, particularly when they screen negative, which is a very big relief for them, they're more motivated to stop smoking if they've continued to smoke. So it really is an incentive program for them to take the initiative to stop if they happen to continue to be on that smoking pattern.
Absolutely, absolutely. I think it's really important for patients to remember that physicians often are very focused, as you said, on lots of other things, but we're in November now, but everybody's going to make a New Year's resolution here in the next few weeks, and maybe as part of your New Year's resolution, if you're a person who's met those criteria and have risk factors, maybe go to your physician's office and take an active role in requesting a scan. Halifax does have some forms that can give all the criteria, so that even if you think it's an uncomfortable conversation, or maybe you're uncomfortable telling your physician what you want, if you brought it in, you can use that as a conversation starter and just say, doctor, I feel like I meet some of these, what are your thoughts? And
Absolutely.
Obviously you can have dialogue with your doctor and go from there.
Yeah, absolutely. And again, we want to see that figure of 3 to 5% screened, approaching 100%. In terms of smoking as well, we might just comment, since it does happen to fall on the Great American Smokeout Day. I want to encourage those of you that have continued to smoke and are really struggling to stop. There are so many more things we can do to help you stop smoking today than, again, when I look back on my 35 to 40 year history, there were so few things we could do in the old days. In fact, we used to tell people, quite frankly, if you try hard enough, you just put your mind to it, you'll quit. We know so much more today about what causes people to continue to smoke. And the bottom line on that is it really is a form of addiction. Nicotine is an exceptionally powerful drug that is highly addictive, not only physically but psychologically. And we have different approaches to that today, both through counseling and through use of medication. Everyone's familiar with nicotine replacement therapy. You can get it over the counter now at your local pharmacy, Walgreens or CVS and the like. But working with your physician to do that can be very helpful. So if you're struggling, if you've tried a half a dozen times and can't quit, don't despair, don't give up hope. Come in and get screened and work with your doctor, so that we can put you in that category of 45 to 50 million Americans that have quit at this point.
Absolutely. And today's the perfect day to do that with the Great American Smokeout. Today's the best day to quit.
Absolutely. We might talk a little bit too about the advantage of coming to Halifax to have this done. One of the important things, and I mentioned this earlier, many of the scans turn out to be positive in some way, shape, or form. Not necessarily for cancer. For example, this is a population of patients that have smoked for many years, so there are other diseases that afflict smokers. Emphysema, fibrosis, bronchiectasis. They are more subject to heart disease, which this scan can pick up little signs in the heart of having coronary artery disease, for example. So coming to Halifax and being scanned and looking for not only cancer but these other diseases can be very helpful, because if you happen to find emphysema in its early stages, you're going to be much more successful at treating that as well. But suppose you have a positive scan. So suppose there's a high likelihood or suspicion that the nodule that they see on your scan is positive. Well, here at Halifax, we have just a magnificent multidisciplinary team. Your pulmonologist or your lung specialist will get involved initially to determine what the route of diagnosis would be. We have all of the most up-to-date and modern techniques for making those diagnoses. We work very closely with our radiologists in reviewing the scans and at times biopsying the nodules. We have a thoracic surgery team here that's excellent in those cases where you have to go to surgery. And then following up, if you need additional therapy from an oncologist, for example, chemotherapy or immunotherapy or radiation therapy. All of that team is here and directed by Jennifer, who's sitting here next to me, to navigate you through all of that. So from the first step, when you're scanned and screened, to the point that you might need treatment and follow-up, we have Jennifer here to help you navigate the system. It's very important that that is all available to you as part of the screening process.
Well, and it can be a precarious area for anybody to navigate. I always tell people I don't know the answer to everything, but I know who does, and they
Exactly.
usually work here at Halifax. So
Yeah, exactly.
we're very fortunate as a community to have some of the best, and I'm always in awe whenever I walk down the hall at the people that we work with that help to take these patients who 20 years ago would have had dismal outcomes, and they're still going strong, and they're still coaching soccer, or they're teaching your children in the community. We're really fortunate.
And we want those survivor statistics to improve. We can see this happen. We can help you quit. We can diagnose you earlier. And we want to see in our community the statistics for lung cancer come down to 0. We really do. And we're here to help you do that.
That would be great. Don't see any questions.